liver, and it can pass easily through the veins or like the blood vessels. But in what happens in sickle cell anemia, they become into crescent or sickle shape. So this is how they become in a C-shaped sickle shape thing, and these are defected cells, and they are not able to pass through the blood vessels because their sides are so like sharp, and they will stuck into the vessels and cause problem, leads to normally the pain and poor blood supply to the organs. So what happens in sickle cell anemia? How do you get it? So inheritance, if the parents is affected with sickle cell anemia, your mother and father both will get has it, then your chances of having sickle cell anemia is high. So if one of the parent is getting like a sickle cell gene, if you inherit one gene is affected but other gene is normal, then you will be the carrier of the sickle cell trait, and you will not have any symptoms. So mainly because it affects the red blood cells, so leads to anemia, and susceptibility to infection increases, and pain crises occur due to the lack of blood supply to the tissues. So symptoms will be pain crisis, so severe sudden pain, often in the chest, joint, and back, and it also leads to fatigue, very tiredness, and weak because of the poor supply, and then swelling in the hands and feet, and that you also called as dactylitis, so swelling of the hands, and sudden. If you see patient is having sudden one-sided weakness, onset of paralysis, maybe the blood supply to the brain is compromising, and patient is having stroke and developing these symptoms. And so the complications will include stroke, acute chest syndrome, which will happen due to the block of the blood flow to the lungs and causing pain and difficulty in breathing. Organ damage can occur due to the lack of blood supply to the organs, and vision problem can occur due to blocked blood vessels in the eyes. So treatment will include pain relief because they are having very sharp and sudden pain. So over-the-counter medications are used for severe pain. Hydroxyurea is another medication that we use in a number of pain crises, and antibiotics are used because they are prone to infection. Right, blood transfusions can be done to increase the number of normal RBCs in bloodstream, and the ultimate treatment that potentially cure this problem is blood bone marrow transplantation. So what education you will give to these patients about eating healthy diet, and drinking enough water, avoid extreme temperature, because extreme temperature, for example, in patient with sickle cell trait, they don't have any symptom until they are exposed to high altitude extreme weather. So high altitude is the like mountain. So what happens when they go to mountain, their chances of their requirement of oxygen increase very much, right? So when the requirement for oxygen increase, but their body is not supplying enough because of the trait thing, and so they leads to trigger of the condition. So avoid high altitudes, hot and cold weathers can lead to pain crisis, and regular checkup. And then gentle exercise can be done, but not encourage them not to.